Now this is a case of a patient having loss. Sorry? ما تحرقهاش. Okay, this is a patient who had LASIK actually, and now they have +4, and we want to do fearless extraction. The patient is 40, for example. So, as you see, this movement, S shape, should notify us about the cornea has been done something to it. And as you see, the chord nu is 0.21. I'm repeating the same parameters just to keep them in mind for cataract cases and clear lens extractions. The best two maps to discover if the patient had previous corneal surgery or not, previous LASIK or PRK or SMILE, are the relative pachymetry map, because it shows us the pattern, and accordingly we can know whether it is post-myopic or post-hyperopic. And this is not only for fancy that you have done something. No, it is for the biometry, because the machine will ask you, the patient had previous LASIK? Yes, it was myopic or hyperopic. Accordingly, it will choose the best formula for you. So you have to know by this. The relative pachymetry map will show you this pattern in the center if it is post-myopic, which means that the center was ablated. So all values in the center are negative. And the tangential curvature map anterior, it shows you the contour, and even you can measure the efficient optical zone that you get after the operation. For example, if you plan for 6.5, doesn't mean that you are going to get 6.5 after the operation. After 3 months, if you do the topography, you may find it 5.5. That's why do not manipulate with the optical zone in order to gain more correction. Optical zone is something holy, شيء مقدس. We cannot manipulate it. So, as you see from this pattern, it is post-myopic because the center is flat. Okay, so now, as you see, the spherical aberration with the pentacam is 0.3. Okay? Is 0.3. While in Cyrus, it is 0.5. Same patient. And I noticed this. Many patients, I do comparison, I find that the Cyrus gives 0.2 more, either the RMS and in individual as well. So 20 minutes finished? So in such case, what do you put a lens? Let's assume that the patient doesn't have astigmatism. What lens do you put? And as you see, it is positive spherical aberration. And the patient would like to have depth of focus after the operation. Would like to maintain the depth of focus. And we know that the spherical aberration gives, even the positive, will give some depth of focus. So either, if you neutralize it by negative spherical aberration lenses that are available, he will lose this effect. Maybe he will get very sharp and good quality of vision, but he will lose that. So what do you put? Dr. Nabil?
The eye-hands, for example, it has a better depth of focus, although it has a negative spherical aberration, but it adds to the depth of focus. It increases the depth of focus. And there are other EDOF lenses that are very tolerant, although they have negative spherical aberrations. But the other part that compensates for that increases the depth of focus would compensate for this. Like the lens comfort, and even I have some experience with the Look Smart. Very, very good results in these cases. Very tolerant.
What is it?
Motion long,
Motion long,
It is enhanced monofocus?
Yeah, it is EDOF, yes.
It is EDOF.
It is EDOF.
It's spherical, negative spherical aberration?
Yes, and it works on the concept of combination of spherical aberrations, fourth and sixth order, opposite sides. It gives a depth of focus, and it's a very tolerant lens in these cases. The lens comfort is a lens that works on, like it has like a segment for near vision, with a very smooth transition zone. It's EDOF as well, and it is a very, very tolerant lens, no problem absolutely in post-operative, post-LASIK patients. I had a very big experience with this lens specifically and with the Smart, and actually in both cases the results are really good.
Fantastic, thank you for sharing your experience.
Easier and safe lens, totally the eye counts.
Yeah, how about using monofocal with zero spherical aberration? To keep the same spherical aberration.
I have a comment. I was just going to tell you this.
Yes.
Now, positive spherical aberration and negative spherical aberration do not necessarily increase the depth of focus. There was a landmark study done, I think in Cleveland, that actually it was an optical bench study, and they showed clearly that spherical aberration plus or minus 0.2 is the sweet spot that gives you a very good depth of focus. And this was coherent with our clinical experience. And when we started using the negative spherical aberration lenses back in the day, from the days of Technis 1 when we started, we had patients that had better depth of focus than the patients that were implanted with normal lenses, in spite of that the previous patients that planted with normal lenses had more spherical aberration. So it's not the amount of spherical aberration, it's the sweet spot of the spherical aberration. So I think keeping the spherical aberration in the neighborhood of 0.2, whether plus or minus, gives the patient the depth of focus. I have just two questions for Dr. Nabi. Have you tried, is this true with the mini well as well?
I have no experience.
Okay, so and the lens, you're happy with the lens comfort?
Lens comfort is amazing. It looks